myself personally, at least recently, too many instances, but, certainly echoing what you said, you can always meet with me and state, you have a concern about, whatever, because as you know, there's a student handbook and we have standards and expectations for student behavior, so the same does hold true also of the faculty. We do also expect the faculty to, emulate the characteristics and traits that, we ask the students to be accountable for. So, if you feel like there's a breach in that kind of conduct, I would say that, you can either speak with us, or again, I always will continue to say, you can also speak to the student senators as well and say, would you speak with, our administrators and let them know that, we didn't appreciate this particular instance, and you can request that they not identify you as a student and just bring it up as a general concern, and I've had students do that. Or you can give permission to use your name or however you want to proceed with that. And I don't think these senators in particular know, but we actually had an instance like that in the spring, and the previous group actually did a really good job because they did withhold the student in question's name, and nor did I press them, tell me the student, who was it. I didn't do that. I respected their desire to be private, and instead, we talked with the faculty member about the perception of, their remarks and the situation, and to address it that way. And of course, when we do those things, I think it's important for the students to know that, we're not going to circle back and give you an update that, we talked with Professor X and this is what we said and this is what we're going to do. But I do want you to know that as a result of anything that you bring forward, we certainly will look at that and address it accordingly.
We also, can I jump in one thing? Some of you actually might have gotten notice already, but those faculty evaluation forms you get are actually really important. So you should get them right around now, between now and finals. And so we obviously don't want you to wait till the end of the semester to submit any feedback. If you're having an issue, we want you to come to us when it's happening. But those faculty evaluations are important. You'll get those actually whether you're nursing or not nursing for all courses, so those are really important. We actually take a look at those to see how the professors are doing and help improve for next semester.
Thank you. Oh, go ahead.
I think this is a really good example of how we can utilize this in our looking after the care of patients and their family members. We want to always respond to them in a very kind and caring manner, no matter how busy we are. So the more that we can make the use of situations where we can all learn from, the better it is. So thank you for bringing that up.
Thank you. All righty, so concern number 5, which will be our last but not least from me, is a 2-part statement. I won't necessarily say a question. It's about the lack of supplies, needing to upgrade the simulation labs, and materials being updated. So the first part is students feel as though the simulations lab should be left open to enable students to practice the skills that they learned during clinicals and not just for class time. And part 2 is the supplies in the labs are limited. For example, there's the running out of syringes, missing supplies, and it was recommended to have someone monitor the lab before students come in for class, just like the past, so that the syringes and everything else are set up.
Yeah, I think this is a really interesting question. I'm glad that this is brought forward. There are other institutions where they have open lab hours, and I think we can look at doing something like that. What open lab hours means, though, is that there is a simulation instructor available there, and the student can go and request to practice a certain skill or a procedure with that instructor there to give them guidance. And I think that's an important distinction because it's not going to be that no one will be there and that you can go and practice things in the simulation lab, because as you can appreciate, a lot of that is expensive equipment, and we do have also responsibility to be good stewards of our resources. But I do think we can look at having open lab where there's an instructor there and you can go and ask for extra time and assistance with a particular, but you need to go with a particular skill or procedure or scenario that you want to do in mind so that we can help you with that. And I don't think that we offer that, and we should look at doing that. And I think that's very important to do it. I would also say that it's an important consideration too, because there have been scenarios at our extension site at Queens where we have to be mindful that that's not our campus, and students being there unsupervised can really be an issue in the case of any medical emergency or anything that happens there, and there's no one there to assist you. So that's why I really say that it would be really important to make sure that any open lab time we do have would be with the faculty or staff member there, just in case anything goes off, and especially so, again, if you are a student that does simulation in Queens and things at our extension site in Long Island City.
If I could just ask a question regarding this topic, what would be the hours of operation that you feel would be the best? I'm sure you've considered that. Anybody can answer the question. So you're saying like from 5 p.m. till 8 p.m. or something like that? Okay, thank you.
I also am someone, if you have ever communicated with me on a more intimate level, I'm also someone that will give you a response, but also, kind of set some realistic parameters on what I think can be done, because I also don't want to set unrealistic expectations, because it also leads to students being disappointed. And so I think that, really an answer, I think you have to also be realistic and say that looking at open lab hours is certainly realistic, but we also should set the expectation that it's not an answer that we could have to you tomorrow or next week. And it may be a semester before we figure out how to implement that. And so that's just realistic, so you understand what kind of time frame that we're looking at and why, and so that you also don't believe that we just sat on your suggestions and concerns, that we heard them, but it may take some time to actually implement what needs to be done to work towards that goal. And then the second part, the supplies. I see some people in the audience saying they can hardly hear me. Okay, all right. The second part about the supplies in the labs being limited. I've heard this from a student or two by email, and actually I spoke with this with Mary DeBono, our Assistant Dean for Clinical and Simulation Learning, and asked her to look into that, and she assured me that we have all of the supplies that we need. It seems, at least in a couple of the scenarios, it was maybe a faculty member in the lab that was unaware where something was stored, and that gave the appearance. In fact, if I remember right, it was about IM injections. There was a student in fundamentals lab that said that they ran out of the syringes to practice IM injections. And so it actually, upon investigation, we actually did have all of the supplies. It was just that faculty member was unaware that the supplies had been moved to a different area, supply closet or what have you. So one of the things that Mrs. DeBono did was just send out another memo advising everyone, here's where things are located for this course and that course, and you can find them there. And if you really think that something is out, then please give me a call, or one of the other staff members a call, and we can help you find those supplies. So I really don't think that we lack supplies. I think that was just a function of and especially here, the building being new, some folks may not be as familiar with the layout of things. So, but in any case in which that turns out to be the case, you can certainly continue to let us know, like a couple of those students did over the course of the semester, one last month or so, and we'll look into that and addressing that so that you can have all the supplies you need for your clinical nursing education.
Thank you. Alrighty, at this point we will take questions from the audience. If you have a question, please make a line behind the microphone in the center aisle. Before starting, I want to reiterate the ground rules for this town hall. Please be respectful of those asking the questions and those answering. Please keep the side comments to a minimum, and if possible, none at all. If you have multiple questions, please only ask one, then return to the back of the line to allow others to ask questions. When you get to the mic, please state your name, year, who you are addressing your question to and your question.
Hi, I'm Daniela, a senior nursing major, and I'm a representative for SGA. One of my peers on the live stream had a question, so I'm just going to ask for her. She said there are a lot of homework and examples like course point and ATI that we're forced to do but aren't accounted for in the grades. There's like a smaller portion of our grade, and is wondering if there's a solution to maybe make that a little bit more portion of our grade instead of it being weighed at 5%.
Yeah, so, there is a history behind that, and I definitely appreciate that there is a lot of work, and first I should thank the student for the question. There's a lot of work that goes into doing the course point. I have no doubt about that, but it's beneficial. So you have the virtual simulations, you have the mastery level quizzes, and the mastery level quizzes, for example, are really helpful in giving you NCLEX style questions to help you demonstrate the knowledge, and the virtual simulations can help you encounter scenarios and test what you're doing that you may not always get to see in the clinical environment, which is just a function of you didn't show up on a day where the interesting stuff was happening, and there's nothing that anyone can do about that one in terms of what goes on in the hospital. But also we have to look at really it's important to make sure that you are able to pass the tests, because if you cannot pass the tests, then it doesn't bode well for your performance on NCLEX. And we really want to make sure that all of you get to not only obtain the college degree, but also have that licensure that you really have worked so hard for. And so there's actually a lot of evidence in the nursing education literature that performance and good, adequate, strong performance on exams, when the exams are created appropriately, that correlates with passage of NCLEX, along with several other things too. And so some of the previous things, being frank with you, under our old curriculum that were an issue was that, the exams were weighted low enough to where you could be a little, just barely on the cusp of passing, but not passing, but then do well on presentations and, case studies and things like that and still pass the course. Well, what we then ended up seeing was that, the students didn't master the skill of passing an NCLEX style test, or a test that really assesses nursing knowledge in ways that the NCLEX will ask the question. And it really did them a disservice when it comes time to sit down and take the NCLEX. And you said, oh my God, but I passed all the courses, how can I not pass NCLEX? So, really it has to be where you have to pass the tests to pass the course. And it's, it's a hassle to have to do all that work for 5%, I get it. But it really is for your best interest. And, in real life, we think about what we do as nurses. Not everything we do as nurses do we get credit for. You'll have patients that will never, ever tell you thank you, that will curse you out and tell you you're the worst person ever, and their family members. But in your heart of hearts that you made a difference, whether they appreciate it or not. So, I'm not being dismissive, but, I also want you to understand that, the work that is there in course point for you to do is really beneficial, and maybe a couple things you don't get credit for, but in the long run, when you do it as we, the experts, tell you to do it, it's for your benefit. And that you will be glad that you put in that hard work when you have that precious diploma in your hands and you have that little thing on the screen. You look up there and it says, first name, last name, and your license number. It's the most reward. I remember that day still today. It was June 13th. I won't tell you the year. And it was, I was ecstatic. I probably texted everybody in my phone, I have my nursing license today. So I want the same thing for you. We both want the same thing for you. And you'll be glad, I think, that you had that work that challenged you to do those things, even though I know it may be a little tedious now. We did do a good bit of work in making sure that the course point work is not piled on too much with the ATI work. So a lot of times the only things in ATI that you're doing is you have a practice A, a practice B, and a final fundamentals. If any of you know some of these students who went through the old curriculum, you'll know that every week there were ATI homework assignments. And the ATI homework assignments, they're valuable too, but you know, we can't give you readings and course point assignments and ATI assignments too. So we were a little mindful with that too and trying to curtail that some. So do know that there was some thoughts that went into that. It is a lot of work. Nursing's a lot of work. But you know, that is kind of the thought process that went behind that one. I certainly appreciate and welcome any follow-up questions to that one if anyone wants.
Any other questions? Anyone at all? Open floor.
My name is Chelsea. I'm an accelerated student here at Riverdale. I just have a general question just about like graduation. Do you guys have graduation like for every program? Like, I think accelerated is a little different, that works differently with traditional program.
Well, so remember, commencement is in May.
Oh, so it's only in May.
So that's commencement. That's
Okay.
graduation proper when you use that word graduation.
Okay.
And I won't speak on that one. Perhaps Dr. Okiogrosso can speak on the policies around commencement and so forth. What we can talk about is you may be referring to penning. So we do have penning in the fall semester, and we also have it in the spring semester for graduating students. Students finishing in the summer can attend the spring penning ceremony. And that's really a traditional ceremony that we've had for nurses, really welcoming you into the profession, and you read the Nightingale, you swear the Nightingale Pledge and so forth. You may be referring to that, I'm not sure.
Okay, yes, I'm sorry. Thank you.
Hello, my name is Ann Rodriguez. I'm a senior nursing student. I also represent SGA as the class president. I want to start off with the statistics for the NCLEX passing rate for the last 4 years. 2018, 81%, 2019, 74, 2020, 71, and 2021 is a whopping 63. With that said, it kind of brings me to my second point, where when I discuss my insecurities about possibly not being able to pass the NCLEX because of the constantly moving pieces of the changing courses. Like, I signed up for this program. This is not my 4th year, like I said. I signed up with 3 med-surges. I went in with 1 med-surge, 8 credits, and God forbid I were to fail, I wouldn't even be able to withdraw because of the shortage of credits, which that leads me now here where we're 1 credit short and have to pay an extra $550 out of my pocket for just an elective credit rather than the 3 credits of each med-surge. Anytime I discuss this with my professors, I get either a very nasty passive-aggressive email back or a pretty dirty look in the face, which I think is quite unacceptable, considering that our passing rate doesn't really show that they're really teaching us with how we're passing. We just regurgitate information at this point. We're not really retaining anything in order to get us and push us through into that NCLEX passing rate. I feel like maybe we could change our curriculums a little bit more instead of making the 1 med-surge, which was a downfall to a lot of my cohort. I came in with a ranging 200 kids. I'm down to 46, 4 of which are men. That's a pretty terrible ratio. And I want to end this on a positive note. I ask that Dr. Akey, you please help us restore, for the time that you are here, please help us restore the nursing department, because I chose this school for the glorious name of nursing, and it's kind of getting tarnished throughout the 4 years that I've been here.
Thank you. So that was a lot of information, and I have a lot of the historical piece that, my colleague, Dr. Ake, who recently joined us, is learning about. So, and I will try to remember a lot of what you said. So, as I recall, you were here as a nursing student when we had an old curriculum. So I have to say, to be honest with our NCLEX pass rate, gives me heartburn, and I think a lot of people here feel the same way. And that's I don't beat around the bush. That is a source of concern, our NCLEX pass rate, of course. The standard required by the state is that we have an 80% pass rate for those that take the NCLEX for the first time. So that means that there's a gap between what we are doing and what is the standard. So then what are we doing to get back to what the standard is? We've actually done a lot of work behind the scenes that, you guys just as students wouldn't know, nor should you know, because you're students, and that's not something that, you really would know about. And that's fine, you will become nurses, and maybe some of you will go and get your doctoral degree and become nurse faculty and so forth, but we are taking steps. And so what we have done is a major piece of addressing that NCLEX issue is the new curriculum that we have. Also, we are engaging with one of our partners, ATI, to talk about next generation NCLEX preparation. I'm actually a writer of your licensure exam. Not many of you know that. But I have been having meetings with ATI for them to come to campus and train our faculty on writing questions that will be akin to what you will see on the next generation NCLEX. So I would also address that concern, and I hear you about the 3 different medical, surgical, nursing courses, but I actually would challenge that one because it's not quite the way students perceive. So, we as a regulated profession can't just change our courses willy-nilly. We have to get approval from the state education department before making a curriculum change. So they reviewed the curriculum and they approved it. So I can address what happened with the 3 med-surg courses. So, the issue with the first 3 med-surg courses, Adult 1, Adult 2, and Adult 3, the truth is that a lot of the student learning outcomes in the syllabus, that box that talks about what we want you to get out of the course, a lot of them were the exact same. And, that's a problem because you're supposed to build from one course to the next on that material. And we had to redesign what we're teaching in those courses. So what we did is we, in all of those courses, talked about a lot of the same things. Every one of those courses addressed health promotion. Every one of those courses addressed geriatric issues. Every one of those courses addressed nutrition. You don't need that. So what we did was we pulled out the geriatric content from all 3 courses and created one course called Nursing Care of the Aging Adult. So in that course, you talk about changes, physiologic, psychosocial, and all of those things that deal with the elder adult. Just that one course and you get it focused. We then pulled out all of the content from all 3 courses that talked about health promotion and optimization of health and disease prevention and pulled it into a course called, guess what, Health Promotion. And that's a first semester course. Then, so now you see there are 2 courses from those 3. And then the 3rd course is Adult Health Proper. You talk about nothing in that course except for nursing management of various adult health issues, cardiovascular, pulmonary, and so forth. And other content we pulled out and beefed up and put it in fundamentals. So you now have in your fundamentals course perioperative nursing, fluid and electrolyte, which students struggle with in adult health. I struggle too, let me tell you the truth. And so we put that in fundamentals so you get it again in adult health when you do the renal week, which I believe is week 8. It's not new information to you. So really, it's not a matter that that content in those 3 courses disappeared somewhere. It's just restructured differently. And yeah, some of the names of the courses are a little deceiving. So you don't have adult 1, 2, and 3. And I could see and appreciate why when you look at the curriculum, you think, oh my God, 3 courses into one. But it's not really the case. And it's actually what our regulator wanted to know and asked us to prove and demonstrate on paper that that content did not disappear. So I really want to reiterate that that content still is very much there. It's just not called adult 1, 2, and 3, but it still is that. And it's spread across 2 semesters. So that, I know the course was hard, and there were things that happened in the course in the spring that we did a little different in the fall. So in the spring, I remember that there was an inordinate amount of readings that students were required to do during the week. And really, it wasn't necessary to do that many readings because the book, let's say, for example, chapter 14, every chapter on cardiac, pulmonary, neuro, and so forth, every chapter has a huge section on health assessment, a huge section on fundamentals, and then there's the section on actual adult health content, how to manage. Well, you all as students, rightfully so, as I remember so many times, that's a lot of readings. How do I know what to pick out? How do I know what's important? Well, you guys have already passed fundamentals and health assessment, so you don't need to read those chapters about, assessment techniques of the patient with cardiovascular disorder. You already demonstrated you passed health assessment in your first semester. So if you look at the adult health syllabus now, all of those readings are stripped out. So you'll actually see, and if you wonder why the syllabus for adult health is so prescriptive about pages, even, chapter 11, page 362 to 389, that's because that is only the content that I want you to really focus on in that chapter. The other stuff I didn't think was relevant because it was about fundamentals and assessment, things you already covered. So that was something we did to streamline the course to make it better compared to when it first ran in the spring semester.
Can I ask a question in regards to that?
Sure.
Then is there any way that we can standardize the syllabus? Because I can say firsthand, compared to my health promotion class and compared to, I believe, Professor Janice was the other professor teaching it, they were completely two different courses, two completely different exams, two completely different discussions.
Is this holistic health or are you talking health promotion? So I would say that is something that is an individual question that I would like to look at in a little bit more detail. The syllabi are standardized, but if there is something along those lines that's very specific, then maybe we can talk about that offline and we look at that. Now, I would also say that, while the syllabi are standardized, everybody needs to be doing, this in week 2 and this in week 4 and whatever. The faculty have the academic freedom to present content in a way that they believe will be helpful and is in line with their teaching style. So that would be something to consider, but if you have something else, then, that would be for, a separate discussion we can look at.
I would also like to add that our mothership, the American Association of College of Nursing, has brought in some new rules and regulations in the alignment of the curriculum. So that is going on right now all across the nation, and it's from undergrad to postdoc. So those kinds of things are happening.
And I really want to reiterate that change in the curriculum that we made. We are really hopeful that will improve, our NCLEX pass rate. We haven't had anybody graduate under that new curriculum yet. In fact, the first cohort to graduate under that new curriculum graduates in 2 weeks. So that will be exciting to see and really be able to evaluate how much better the new curriculum is compared to that. But there's also a complicating factor, and I have to be real with you. Anytime there's a new NCLEX, scores across the nation tend to drop. And that's temporary because nobody knows how to prepare for a brand new licensure exam. So I think we sit with the curriculum that we have, trust that it will work, and sit with it a couple cycles and see how that goes.
Alrighty, thank you everyone for those questions. If you have anything specific, our panelists will be here for a few minutes. We have taken notes, and SGA will continue to follow up on your concerns and questions, and will work with the nursing department to address them. You can always email SGA at studentgovernment@mountstvincent.edu. Okay, thank you to our panelists for attending today, and the meeting is adjourned.